All right, now we're going to look at the different types of anatomical positions. So basically, I'm going to name one, and I'm going to define them. Keep it very simple. Why do we have anatomical positions? Well, you know, when the surgeon is doing some kind of operations within maybe like 6 or 7 other surgeons, it would be not a smart idea, for example, for the surgeon to say, you know, my left, down, far, you know. So again, they have these different terminologies that they use in order to have the exact position of interest in that case. So that's one scenario, right? But if you look at other scenarios, there's hundreds and hundreds, and I'm not going to waste my time going into that because that's not that important. Now, we have different types. So we want to talk about something that is above or towards the top, towards the skull. We say superior. So another name for superior that you'll see a lot of the times is cranial. All right, so I'll put a little parentheses in there. So cranial is also used interchangeably with superior. So superior is referring to above. Below is referring to inferior. Below, going down. All right, another name for this is caudal. Caudal means referring to the tailbone. So cranial is referring to the skull. Inferior is referring to the tailbone or to the bottom. All right. Now we have front and back. So another name for front and back is, so for back we can put posterior. If you ever hear the word dorsal, this means the same thing as posterior. Sometimes a long time ago, anatomists decided let's use the same word for the same time. Okay, they mean identical things. Another one for the front now. So posterior is referring to the back. To the front is anterior. So posterior is the back, anterior is the front. Another name for anterior is ventral. Okay, and the reason why I matched them up in this order is when you want to refer to front and back, you either use them in pairs of posterior, anterior as one set, or the other, which is dorsal and ventral, in the other set. Okay. Now, when we look at the midline, where is the midline? The midline is this line that separates, goes right down the middle, that separates you into 2 equal spaces, left and right. Towards the midline is referring to as medial. Okay. Away from the midline is referred to as lateral. Okay, so these are some terms that you'll see a lot. Now maybe we'll do a couple examples in order to get something done. All right, so you have medial, which is towards the midline, lateral, which is away from the midline. Now we have, what else do we have? We have proximal and dorsal. Proximal and dorsal is referring to when you, in relation to one focal point. So when one specific location, you say proximal is referring to something that is close. Distal is something in relation to that focal point is far. So for example, if I'm looking at my focal point is in my shoulder, my bicep muscle would be proximal to my shoulder, whereas my wrists would be distal to my shoulders. Okay. Now whenever we look at it on a 3-dimensional plane, now we're going to look at the different layers. We look at superficial, right? So what is superficial? Superficial refers to something towards the surface, right? So if I were to ask you, the skin is superficial towards the what? Any kind of system, right? Any kind of system. So the skin is the most superficial region. So it's superficial to the bones or superficial to the nervous system, okay? And the opposite, away from the surface, is referred to as deep, right? So the muscular system is deep in relationship to the skin or the integumentary system here that's presented for us. All right, so these are the main anatomical terms that you'll be using and you'll be seeing. Okay, and make sure you understand it, right? So for example, if I say the heart is what in relationship to the vertebral column, so the heart would be in front, correct? So it would be anterior to the vertebral column, right? What about, let's see, what about the skull is what in relationship to the heart? The skull is either cranial or superior in relationship to the heart. And one thing that's really important that people misunderstand is a lot of these words that they can be used in terms of direction, they can be used interchangeably, right? So something can not only be necessarily superior, but they can also be medial, or something can be inferior, but also lateral as well, okay? So make sure you understand those two distinctions, and this is generally the basics for all of the anatomical positions.